This is Dr. Bernstein with Dr. Bernstein's Diabetes University. Our subject for today is psoriasis. Why psoriasis? Well, when I started in practice, I used to draw my own blood, not on me, but on my patients. And when you draw blood on somebody, somehow you end up holding their elbow while you stick the needle in. And I found that every patient had a rough elbow. And rough elbows, I knew from personal experience, are characteristic of psoriasis, which is a skin disorder where skin cells proliferate in a semi-uncontrolled fashion. And the most common symptom is rough elbows. So when I felt a rough elbow, I'd also look at their fingernails because it was very common to see changes in the nails of people with psoriasis. And indeed, almost all of these people would have longitudinal stripes in their nails. I shouldn't say stripes, lines, fine lines on their nails. I also noticed something that I didn't know but learned, that the bulk of these people with psoriasis had missing lunulae. If you look at a normal finger, you'll see what looks like a quarter of a moon at the base of the nail near the cuticle. And people with psoriasis have missing moons, or missing quarter moons. I have none on my fingers. I've had psoriasis since I was 12 years old. Another characteristic of psoriasis is shaggy cuticles. Another characteristic is nails that break easily. Another characteristic is itchy scalp, very common. Another one would be itchy nose, itchy ears. Yet another one is perianal itching. Many years ago, a patient asked me at a visit in a quiet voice if I could do anything about his perianal itching. It was embarrassing to walk around scratching most of the day. So I said, let me feel your elbows. And sure enough, he had psoriatic elbows. So I suggested that he use hydrocortisone ointment that in this particular case worked. Now, I've had patients with psoriatic ears where it looked like they had cauliflowers growing out of their ears. It was only one patient. One patient had what was cauliflowers growing out of her ears. That was skin that had proliferated. I had a man who had it all over his body and couldn't concentrate on the training when he first came because he was itching all over and was busy scratching. And we sent him to a dermatologist who had a light box in his office where you stand inside a box that has ultraviolet B lighting, and that's a treatment for psoriasis. There are many treatments for psoriasis, and not all of them work on everybody. The rough elbows frequently respond merely to lubrication, and then it's a matter of which lubricant will work. Well, a good lubricant would be olive oil or jojoba oil, but they might not work for some people and might work for others. 1% hydrocortisone is an over-the-counter mild steroid that you can use for about 2 weeks. after 2 weeks or so, it stops working. So it's not something to be used every day chronically for the rest of your life. You would switch to something else if the hydrocortisone works after maybe 2 weeks or so. For another use something else for a month, and then go back to the hydrocortisone. There are so many things used for treating psoriasis that I'm not going to even attempt to mention them. But I will mention that in the USA, there's a National Psoriasis Foundation. You can look them up on the internet, National Psoriasis Foundation. They publish a monthly newsletter. They also publish a medical journal. By the way, when I tried to point out that virtually 100% of diabetics have psoriasis, the medical journal their journal wouldn't publish it. When I submitted it to the diabetes, and they said to me, we're interested in psoriasis, not diabetes. When I submitted the same article to major diabetes journals, they said, we're interested in diabetes, not psoriasis. So I couldn't get it published. This is my first public disclosure of this, but I think I've had 2 patients in 30 years who did not have psoriasis. The newsletter of the National Psoriasis Foundation lists many treatments. They even have a column called "It Works for Me," where some people tell what helped them. And what helps one person may or may not work on another person. So there are many, many treatments. Some of the extreme ones involve the use of monoclonal antibodies that destroy a portion of the immune system that's causing the psoriasis, but can also cause an immune deficiency. There are things like salt water, all kinds of oils, steroids, and I mentioned itchy nose. I have psoriasis, and tonight I have an itchy nose. Tomorrow I might have an itchy scalp. The next day I might have itchy ears, and so on. So if you go to the National Psoriasis Foundation publication, I think they charge $20 or $40 a year for a membership, and the publication is then free. And I'm sure if you're overseas, you can still join and go to their website. You'll learn about the many treatments that are available. There are also dermatologists who specialize in psoriasis. Not every dermatologist is an expert on psoriasis, and I've found many who make mistakes and don't know how to recognize it. So that's about all I can tell you, but it affects almost every diabetic. Thanks for watching, and look below if you want to see how to listen to my monthly teleseminars that are free. You can get them on the internet. See you at the next session. Before you sign off from this session of Diabetes University, take a look at my book, Diabetes Solution, which you can view at the site listed below, or you can purchase from any online bookstore. Also, visit my monthly seminars, teleseminars. The site for getting these free seminars is listed below. You can also join the Diabetes Forum, where you can ask questions to other diabetics who have read my book and have been using it. And one last thing is, if you go to the teleseminar, you can ask questions which I will answer, if not the same month that you ask the question, within a month or two thereof. Thanks.